Hey, Polly.
Hey Greg, how are you?
I'm doing really good,
Really good.
really good. Because for 2 years now, I have been trying to get our next guest on the podcast.
Who is it?
Planned Parenthood. So, like
Oh,
2 years I've been
champion,
trying.
champion in sexual health.
Yes, yes.
Yes.
And I've always see them at many, many tabling events.
Hmm.
Always great conversations with whoever's there. And then I keep reaching out and finally it happened. So today
Yes.
we will be having Planned Parenthood on our podcast.
Amazing.
So without further ado, today joining us on Totally Preventable, we have Dr. Icy Best, the medical director of Planned Parenthood of Southern New England. How are you doing today, doctor?
I am doing wonderful. I'm so glad to be here with you. Thank you for having me.
That's our pleasure. Our pleasure. To start off, as we normally do, can you tell us a little bit about yourself and how you got to where you are today?
Sure. So I am the medical director of Planned Parenthood of Southern New England, as you said, PPSNE, and I'm a family doctor by training, which means I went to medical school and then I did my residency at the University of Pennsylvania in the city of Philadelphia um, in family medicine. So, I've spent most of my career so far being a primary care doctor, taking care of people of all ages and all genders, um, helping them to make sure they're getting their preventive health care, but also treating, acute illnesses, cough, cold, back pain, knee sprain, but also treating, chronic illnesses like high blood pressure and diabetes, and really looking at the whole person, the whole family unit, and the whole community to see how we can make our communities healthier.
When you said, cough, cold, knee pain, back
What are you
pain,
looking
just, just describe my Saturday.
I thought you were
Exactly.
describing
No,
me.
that was my Saturday right there. Jeez.
So that's really kind of where I started. And then I joined Planned Parenthood of Southern New England about 2 years ago as the medical director, overseeing our primary care program specifically and our STI and HIV prevention program, as well as our gender affirming care program. So really sort of focusing in on those needs.
Excellent. Could you give us a little overview on STIs and how they're affecting patients today? And maybe even start with when I say STIs to someone my age, they're like, what? Yeah.
Yeah.
And I'm like, well, STD is now STI. And like it's
Yes.
maybe even going over that a little bit
For sure.
yeah.
Exactly. So the language is, constantly changing. I'll give you that. We say STIs now to stand for sexually transmitted infections. And in the field of healthcare, we have sort of tried to move away from the term STD. I still say it all the time because it is a term that more people know.
Mhm.
But just recognizing that, these are infections and, all of the infections that are sexually transmitted are treatable. So, rather than labeling them as a disease, which sometimes can be a little bit more of a stigmatizing term, we've tried to shift our language to infections, um, just like any other infection that can be treated. When we talk about STDs or STIs, the most common infections that we're talking about are things like chlamydia, gonorrhea, HIV, and syphilis. And there are others, trichomonas, there's herpes and other infections, but really the most common, the core four would be gonorrhea, chlamydia, HIV, and syphilis.
Wow, I never even heard of trichom. Was it trichomonion?
We
I,
call it trick, but trichomonas is, its government name. And so, these are all infections that are transmitted through sex from person to person, and they're transmitted, typically by the exchange of bodily fluids. And again, like I said, they are all infections that we can test for and infections that we can treat.
how's their prevalence evolved over the last 10 years?
Yeah, that's a great question. That really is the reason for my calling to this work and the reason that I am, so passionate and happy to be here talking about this today is that the impact and the burden of these infections has really been increasing in a lot of ways in our community over the last decade. We have seen actually the rates of syphilis which I feel like is one of the less talked about ones. Syphilis rates increased by about 380%, almost 400% in the state of Rhode Island over the last decade. And gonorrhea, rates are not far behind. They've increased more than 200% in the last decade. So, we have actually seen a slight decrease in the rates of HIV in Rhode Island specifically. But, as a whole, sexually transmitted infections, do seem to be on the rise.
Wow.
So how important is getting tested?
Critical. It's really important. And I think when we try to understand the importance of getting tested and getting treated, it's also important to understand, why do we care about STIs? What is the impact? If you have an STI, why should that matter to you? So first of all, for the infections like gonorrhea and chlamydia, those infections can infect different parts of the body, whichever parts of the body people are using for sex. So it can infect the pelvic tissue, so it can infect the vagina or the penis, the urinary tract, it can infect the rectum, and it can actually infect the throat as well. And infections like gonorrhea and chlamydia are actually one of the main drivers for something called pelvic inflammatory disease, which is an infection of the reproductive organs like the uterus and the fallopian tubes and the ovaries. And it actually turns out that these infections, when left untreated, is one of the main reasons for infertility in the long run. So many people, can have these infections and sometimes have no symptoms at all. They feel totally fine. They don't have a fever. They don't have pain. They don't have discharge. And so they would not know that they have an infection. Meanwhile, this infection actually is taking hold inside of their body and causing long-term scar tissue that can actually set people up to be unable to get pregnant or to have a pregnancy when they are ready and when they want to. And it can also be a main driver of something called an ectopic pregnancy, which I think people are hearing a little bit more about in the news these days. Ectopic pregnancy is where a pregnancy happens outside of the uterus, so in a place that it's not supposed to and a place that it can't grow. And an ectopic pregnancy can actually be a life-threatening emergency. And interestingly, the majority of ectopic pregnancies do seem to be related to, a past infection of something like gonorrhea and chlamydia that resulted in scar tissue and sort of threw off the normal, natural anatomy, and led to, a pregnancy happening in a place that it should not. So it can actually lead to some pretty, serious and in some cases life-threatening conditions. And, many people don't know that they have infections like gonorrhea and chlamydia if they don't get tested. There's also, infections, like we said, like HIV and syphilis, which those effects look a little bit different. HIV, which is human immunodeficiency virus, is a virus that can affect the immune system of, the individual with HIV. And over the course of years, over their lifetime, if untreated, HIV can weaken the immune system. It makes you immunocompromised and puts you at risk of some pretty serious, and again, in many cases, life-threatening infections that can really lead to premature death. And again, HIV is totally preventable and it is treatable, right? So there's no reason that people should be having to experience those sorts of severe effects if they're getting connected to the testing that they need early and the strategies for prevention. And then lastly, I just want to talk a little bit about syphilis. Syphilis is an infection that can cause sometimes sores, interesting painless sores on the genitals. But again, left untreated in the long run, syphilis can actually affect the brain, and it can affect the neurologic function. So the strength of your muscle, the clarity of your thought, and the entire function of your brain, which we call neurosyphilis. And of particular interest to me and to us at Planned Parenthood right now is the rising rate of maternal fetal transmission, what we call vertical transmission, where people who have been infected with syphilis and don't know, haven't been tested, haven't been treated, and then become pregnant can actually spread that infection to their developing fetus. And a child that's born with syphilis can have a whole host of disabilities related to that syphilis infection, which again is totally preventable if we treat that's and diagnose that syphilis infection early in pregnancy, or ideally before pregnancy occurs.
So should all genders, everybody be being tested just annually? I was going to say if you had multiple partners, but I feel like maybe you don't know if you're like what your partner is up to.
Right. That's a really, really important point. So, sometimes we have lots of patients where they might have only one sexual partner, but if their partner has other partners, then all of a sudden you just can't really wrap your hands around what your risk really is.
Right.
Right. So we do recommend that everybody get screened routinely. And again, I said my background is a primary care doctor, so this is something that I talk to all my patients about during just their annual physical. And I'm always surprised when I talk to my own family members or my friends that their doctors and their healthcare providers are not bringing this up as part of their routine care as much as they should. I talk to a lot of people who say that they haven't been asked in years if they wanted to get screened, right? And like we talked about, we really shouldn't be waiting for people to show symptoms, because oftentimes these infections can be, progressing and kind of running rampant within the body in a way that's really silent. So we recommend people to be just routinely screened. It's a great thing to incorporate into your annual checkup. And then we also recommend that people get screened based on any potential risk, right? And again, risk doesn't have to mean that you think that this person that you had sex with has an infection, but just that there's the unknown, right? If you have a new partner, or if you have a partner who has or may have other partners, you want to be getting yourself tested. So we will, often recommend, particularly for younger folks in the, age range of, 16 to 24, and I would say 16 to 40, but 16 to 24 is what the CDC recommends, to be getting tested like every 3 months, because that's where we're really seeing the highest rates of these new infections.
So that's not just your annual visit. That's
right.
Okay.
Right.
I have
Right.
so many questions. So I mean, wow. So first I wanted to ask, you were talking about chlamydia, and
Yeah.
I know you said the pelvic
Inflammatory disease,
Now,
or PID. Yeah.
gave examples of what would happen to female. What about the male? What are the ramifications of that?
So these infections can also spread throughout the reproductive tract in patients with a penis. So that can lead to something called urethritis, which is basically an infection where you might have discharge from the penis, which is typically, that's not normal. Typically you should not have discharge from that part of your body. So you can see discharge, you can have pain with urination, or sometimes just pain when you're not doing anything, pain with sex, pain with ejaculation, sometimes blood in the urine. Actually, we see a lot of people coming in for blood in the urine that turns out to be because of an infection that they didn't know they had. And then also it can cause a more serious type of infection called orchitis, which is an infection of the testes, where the testes can become very inflamed and sometimes very tender and swollen. And again, I want to emphasize, you can have these infections for months and even years with none of these symptoms, right? So just because you feel fine doesn't mean that you couldn't have an infection. But when they do have symptoms, those are the types of symptoms we can see. And again, it can actually lead to long-term scarring in the testes, which is, again, really important for long-term fertility.
Another question. The testing, you mentioned, like your primary care. Would these things show up when you do your blood work, perhaps?
That's a great question. So some of these tests can be done by blood work, and then some of them are done by swab or urine samples. So HIV and syphilis are most commonly tested with a blood sample, but you cannot test for gonorrhea and chlamydia from a blood sample. So for gonorrhea and chlamydia, the most common way that people test is with a urine sample. But this is an important message that I want to get out, which is that there is data that shows we miss a lot of infections of gonorrhea and chlamydia if we only test by urine. So you can do a pelvic swab. So urine tests are perfectly fine, high quality for people with a penis. You can do a swab for people with a vagina, which is a little bit better at picking up an infection. But more importantly, we want to make sure that people are doing multi-site testing if they are having sex with multiple parts of their body. Because like I talked about, you can have infections in the rectum and infections in the throat. And it's pretty common that when we do test all three parts, we find that somebody might have an infection in one of those three, but their urine test is normal. There's no infection there. So that person could have gotten tested and left with the confidence thinking that they don't have an infection when actually they have an infection in a different part of their body that they use for sex. And they can still spread that infection if they use the body part, right, for sex in the future where there was an infection. But we didn't test that. And we told them, you're good, you're fine, you don't have an infection, no need for treatment. And then, they're living their life with confidence. False confidence. And so we really have an obligation, and we have been working really hard at Planned Parenthood to get that message out to all of our patients to make sure that they, we bust that myth and that they know, all of the tools that we can offer to help keep them healthy.
Can you tell us about some of the myths out there around, excuse me, STI prevention?
For sure. So I think for one, there are a lot of myths about how STIs spread. So like I said, just not knowing that you can spread or receive an infection of an STI from oral sex, that's a really big myth. I think that people think that you can only get infections from sex that's a penis and a vagina, right? And that's definitely not the case. So, knowing that really any of those body parts, the mouth, the rectum, the vagina or the penis, any of those, when they're involved, right, you can get and receive infections. I think that there are also some, myths about who is at risk. Again, I think that there can be a lot of stereotyping, which has proven really, really harmful. I think cis women are not included in this conversation nearly as much as they need to be, particularly as I mentioned, with some of the long-term effects on the reproductive health and, the reproductive organs and fertility and things like that. A lot of the time this conversation focuses too narrowly on men who have sex with men, gay men, bisexual men, and trans women. And although there are higher rates of transmission in those populations when we look at the data, for our states and nationally, there is still a lot of infections happening among cis women and really among all groups. So I think that that's one of the big messages I would want to get out there too, is that anybody can get an infection. If you're having sex, you're having sexual contact with another human being, right? There is some risk there. There is, potential, and there are tools to, protect yourself, and everybody needs to be made aware of those tools. So I think in particular, I think we've done an inadequate job in healthcare as a field of getting that message out that, all genders really need to be aware of the tools to protect themselves from STIs and to make sure that they're getting tested and treated.
What advancements in STI testing technology have been the greatest help to the work that you do?
I think one of the biggest tools for STI prevention has been PrEP. So PrEP stands for pre-exposure prophylaxis against HIV specifically, and then doxypep, which I'll tell you about in a minute. So PrEP is a medication that can be taken either as a pill or as an injection, and that helps to prevent the spread of STIs. So PrEP is for people who don't have an HIV infection to help prevent themselves from getting HIV, even if they get exposed. If they have sex with somebody who has HIV and, maybe they knew, maybe they didn't know, maybe they're on treatment, maybe they're not. But regardless of those factors, if you are taking PrEP, the chance that you get HIV from that person is reduced by over 90% in many of the studies. So PrEP can be taken as a daily pill, a pill you take once a day, again, when you don't have HIV, that helps to lower your risk. Or you can actually take PrEP on demand, which is, more popular for folks who are not having sex as much, like on as a regular basis. So, sometimes we'll see it on folks who they're going on vacation and they know that they need PrEP for a short time, or, folks who are, just mostly meeting up on a predictable schedule, like they're maybe using an app and they know, okay, tonight I'm going to go out, I'm going to have sex probably or possibly, and I want to be prepared for that. So they can take 2 pills before sex, and then 24 hours later, and then one more dose 24 hours after that. So it's 3 doses in all, and that can, again, significantly, around 90%, reduce the chance that they get an HIV infection even if they were exposed. And then the last formulation for PrEP is injectable PrEP, and that's one of the newer options in the last few years. We've had a lot of patients who've chosen to make the switch from taking a daily pill to getting an injection for PrEP. And that's an injection. You come into the health center and you get that injection once every 2 months, and you are covered. And that actually seems like it's, really in the high 90s% of preventing infections, because you can't miss a pill, so as long as you're on time for your injection, it's really, really proven extremely effective at keeping people protected against HIV. In terms of the innovations, one of the newest things is called DoxyPep, which a lot of people have never heard of. Have you guys heard of DoxyPep?
Not at all.
No.
All right, so DoxyPep is, we said PrEP, as people know it, is for HIV, which makes sense that, that was the first thing we focused on, because as of right now, even though HIV is definitely treatable, there is no cure yet. So that was kind of the focus for a long time. But at this point, we now also have a new tool called DoxyPep, which is 2 tablets of doxycycline antibiotic that you take 1 dose, 2 pills together, within 3 days after sex, when you are not sure, about the status of your partner, you're not sure if you could have been exposed to an STI, and it lowers the chance of getting all of the other 3, gonorrhea, chlamydia, and syphilis, by about 2/3. And interestingly, that DoxyPep is the exact same medication we use for Lyme disease prophylaxis, which a lot of folks in Rhode Island will be familiar with, right? If you find a tick on you that you think has been on for less than 3 days, just like that sexual exposure, less than 3 days, you can take 2 pills of doxycycline to prevent Lyme disease. And apparently it also helps to prevent gonorrhea, chlamydia, and syphilis.
I was going to throw that in. And if you have Lyme disease,
Wow.
it'll help too.
Did not know that.
Yeah. So we try to get those prescriptions out in advance, and then people just have, those pills in their cabinet, and they can take it when they need it, and then come in for their periodic testing.
Do you have some plans in place or measures in place about talking to your patients about how they talk to their partners about STIs and lowering the stigma around that?
We do. We talk a lot about that in our health centers, because that's such an important part of this strategy, to be able to keep yourself healthy. So we really think about STI testing as self-care and as a way to show, care and love to the people that you care about, right? What better act of love than to take care of your health, right? Which is the most valuable asset that we all have. So, we do talk to our patients about, just the importance of that, and about sort of framing it as this is a normal everyday conversation that you should be having. If you're going to be having sex with somebody, right, you should be empowered to start this conversation and to just ask, like, when is the last time that you got tested? What were your results? Have you had any infections recently? Do you want to go get tested together? Right. And then we also have a patient portal so people can see their results. And we actually have a lot of patients who will, tell us, they show their results to their partner, and they kind of, trade results just to see and be able to have that confidence of what they're doing, and giving them the education so that they can also educate their partners. We have a lot of patients also who take the information that we give, and, they're the ones educating their partners about PrEP. And they'll come back and they say, I don't have sex with anybody who's not on PrEP, because, or on treatment for their HIV, because, I want to keep myself healthy and I want to know that they are somebody who is conscious about their health if I'm going to let them have sex with me too. So I think a lot of our patients are doing really, role models for how to have some of these conversations.
I think maybe I'm wrong, but I think younger people now have the ability or are feeling more empowered to be able to have these conversations than when I was young. I'm not sure if that's true. I'm just thinking of the young people I know. They seem open and able to
I
talk
hope
about
it's
things.
true because it's so important. Yeah.
Do you have any connection to parents? Are you able to, to share
Yeah.
messages with parents of how important testing
Yeah.
and
So
safety is?
that's actually a really, again, important part of our strategy too at Planned Parenthood, making sure that, again, that it's not just the individual in front of us, but thinking about the health of the family and the community. So, we always welcome parents who are a part of their teen's life. If the teen is comfortable, we always welcome parents into appointments, either separately or together. Like last week, I had a patient and her mom, and the patient wasn't comfortable. She was 16. She wasn't comfortable talking about things in front of her mom, but she was more comfortable with me talking with her mom separately after. We are always happy to do that kind of thing. With any trusted adult. It doesn't have to be a parent, even if that's not who the teen is most comfortable with. But we also have a really robust education department as part of PPSNE that does specific trainings and education sessions for teens and their parents or other trusted adults. We have a program called Lift where they actually bring together teens and their parent, guardian, or other trusted adult and have them, practice having these conversations, and they teach the parents and the teens together, about some of the evidence-based content and, some of the things we've talked about here today, in an age-appropriate way. But they also, specifically focus on equipping parents, because there's so many parents out there who they didn't get this, right? They didn't have these conversations with their parents, and and we hear that a lot from parents too, that they have experiences that they don't want their children to have, and they want to do better for their children, but they don't know where to turn for those resources. And so at PPSNE, we are elated to be able to to provide that training for for parents, for guardians, and also in schools for teachers, so that adults can be more comfortable providing the education and support that teens need to be able to learn about consent, learn about healthy relationships, and be able to learn about just their reproductive health in general.
That has to be probably the most silent ride home. If you're a teen and you talk to your doctor, then you're like, can you talk to my parent? And then that ride home. But I don't know. That'd be tough.
We're just glad that the conversation is happening, however it's happening. And in most of those cases, we can actually get them on the same page. You go back in and you're like, so interestingly, I think your mom knows a lot more than you think she knew, or vice versa. I think your kid knows a lot more than you think that they know. And we want to help people get on the same page. So yeah.
And ultimately, if they've both agreed to be there, they're
right,
concerned about each other, well, their health and each other's health. And yeah. Stop for ice cream. Stop for ice cream. It'll be fine.
I hope we have a couple of years before.
Sometimes baby steps.
Yeah.
Are there any antibiotic resistant strains of like the big four, for instance?
Yes, for sure. So we have seen some resistance evolving over the last few years with gonorrhea and chlamydia and HIV. With HIV right now, we are in a pretty good place of having a good combination of medication. So there is no one ingredient alone that can treat HIV because of resistance, but we have a good handle on that. Combinations. For chlamydia, there has been a change. We used to always recommend, one dose of a medication called azithromycin for chlamydia, and now we're finding that there is increasing resistance, and so we've moved to a 7-day treatment for most people, to try to stamp out that potential resistance with azithromycin. And then with gonorrhea, same thing. There we actually changed, when I say we, I mean the CDC and the healthcare community as a whole, right? Changed the recommendation a couple of years ago for gonorrhea. It used to be, have to now double the dose of the injection that we use to treat gonorrhea. It used to be, 250 milligrams, now it's 500 milligrams to be able to combat the burgeoning resistance against gonorrhea. So yeah, absolutely.
What causes it to become like, I don't want to say more lethal, but more resistant? Like, is it?
Yeah, I mean it's kind of a natural thing that happens with any infection. We see it with the flu every single year. We see it with COVID where the strains kind of change. One of the things we know can really, breed resistance is when people don't finish the recommended antibiotic regimen. Because then it's just enough for the bacteria or the virus to learn how to live with that treatment, but not enough to actually kill it, and to end the infection. So that's really the main thing that people can do to prevent resistant strains is take all of the medication that you're prescribed, and if you're having difficulty taking it, let your healthcare provider know so that we can figure out an alternative plan, so that you're not setting yourself up and the community up for resistance.
So we see Planned Parenthood at a lot of tabling events that we do.
Yeah.
You guys
Good.
have amazing tabling stuff. Like it's always like, what's going on over there? And everyone's like intrigued by what's going on. But we do see a lot of barrier methods
Yes.
being promoted there. How effective are barrier methods?
Very, very effective. When used correctly. So, there are external condoms and there's also internal condoms, and there's dental dams. Those are all barrier methods. And they are also, around 90% effective when used correctly, and really can help to, reduce the risk of STI transmission. But we do want to make sure people know, how to use them because there can be, mistakes. We want to make sure people are checking the expiration dates before they use them, that kind of thing to make sure that they're getting the full effect. And we give out a lot of free condoms at our health centers and at, tabling events and stuff too, to make sure that people have access and, cost is not a barrier to being able to protect yourself.
Now, how does Planned Parenthood ensure confidentiality, especially, with this topic? And how do you create the safe space for patients to discuss their problem?
Well, we hopefully, as all healthcare organizations, have an obligation to, patient privacy first and foremost. So, when patients come into our health centers, they can trust that we don't disclose any of their information to anyone who doesn't need to know it to be a part of their care. So, we will share information with like an insurance company for billing, or a pharmacy for prescribing medication, that sort of thing. But beyond that, if somebody calls asking for your information, we have to have explicit permission from the patient. Even, the laws in our states allow for, most teens to be able to access sexual and reproductive health care, when it comes to STI testing, without having to involve an adult. And that really was a public health strategy by, Connecticut and Rhode Island to make sure that teens where we see these infections are getting the testing that they need. So, so we respect we really understand the importance of privacy. If people have to worry that their information is going to be shared in ways that they're not comfortable, they're not going to come in and get testing. And we know that that's going to lead to, the spread of more infections, and we don't want that.
What measures do you have in place for underserved communities that might be at more risk to offer STI testing and other services?
That's one of the things that I am most proud of working at Planned Parenthood is the things that we do to make sure that our care is accessible for everyone who needs it. And we really pride ourselves on, particularly the folks in our community who face the most barriers. We are here for them specifically. We're here for everyone, but we really want to make sure our systems are designed for those who cannot find, their place in the healthcare system. So we have, first of all, sliding scale fees that we offer. So, for folks who don't have health insurance or are not comfortable to use their insurance for privacy reasons, right? That happens sometimes, that we offer sliding fee scales so people can, pay what they can, basically. Their charge is adjusted based on what their income is. And that actually includes that for those who are the lowest income level, that they can get testing for free. Their tests their HIV, gonorrhea, chlamydia tests are free at Planned Parenthood. And then for those who might be in the, somewhere in the middle, that their costs are reduced. We have a really wonderful, incredible powerhouse team of patient navigators who help patients to, pinpoint what the barriers are that are getting in the way of them being able to access their testing, their appointments, their treatment, their prevention, and help them to remove those barriers. So we have a navigator whose role is helping patients to specifically overcome barriers to getting PrEP. PrEP can be up to $4,000 out of pocket, depending on what type you choose, if you had to pay out of pocket. So that's just, that is not accessible for most people, especially those who don't have insurance. And we have, but our navigator is extraordinary and, is able to really come up with a plan for everyone. We don't have patients at this point who cannot access PrEP because of cost. We always are able to find a way for them. But the system is confusing and it's hard for people to be able to do that by themselves. So that's where our navigators really come in. We have navigators who can help folks to understand the insurance system to be able to get on insurance if they qualify, but they're just feeling, lost and don't know where to start. We have a navigator who specializes in that. And then one of the other two more strategies I'll talk about are telehealth. Telehealth was something that was really born out of the pandemic, but has proven to be one of the most valued resources for overcoming barriers for those in rural areas and for those who are whose work schedule or their childcare or other caregiver responsibilities just don't allow them to drop what they're doing and travel to a health center in person. Telehealth has really closed that gap a lot. And we do, it allows our patients to meet with a clinician. They can't collect their swabs over telehealth necessarily, but they can meet with a clinician, they can get the education. We can start people on PrEP, and DoxyPEP over telehealth. And then we can be able to order their tests sometimes to a lab that might be closer to them than their nearest, Planned Parenthood Health Center. And the last thing that we have implemented just about a year ago now is something called express visits for STI testing. And so these are visits for people who are not having symptoms. They're just trying to do what we ask them to do, which is get their routine screening even when they feel fine. And we really looked at our system, 2 years ago, and we said that we can do better. And we at PPSNA, we set a goal to close the gap in health equity for the Black community and the LGBTQ plus community in particular, but to really try to tackle the rising rates that we were seeing of all of these 4 infections that I mentioned. And so we created a new model where instead of having to come and wait to see a clinician, people can come in and collect their own test samples. So they can do self swabs for oral testing, rectal testing, and urine testing or pelvic swabs. Okay. And this is an evidence-based strategy. There's lots of studies that show that patients are just as good as trained clinicians at collecting and detecting these infections if they're, trained, educated on how to collect the swabs correctly. And by implementing this model where, we have these express visits, it has allowed us to tremendously increase the number of visits that we can offer to get patients in for testing. It's decreased our wait times from close to 2 weeks on average. 2 weeks to get testing for me is just, that's ridiculous. If you want to get testing, you want to get testing now, and you should be able to. So, we were able to decrease our wait times from close to 2 weeks to now you can get in same day or next day at any Planned Parenthood Health Center to get your STI testing. And we've actually seen, almost a 25% increase in the number of infections that we were able to detect with this model. We see that, these visits fit better into patients' lives where they're in and out in, 15 minutes. They're able to come in and get their testing and leave. They still get education about PrEP. We still have lots of folks who come for those visits and then they end up leaving on PrEP. But they're just able to get better access, and it actually has lowered the cost for those testing visits for patients as well. So that's one thing that we are, really proud of and really want people to know how easy it is to make an appointment at PPSNE and to be able to come in and get your testing, so that should not be a barrier for people coming to get their test done.
I would be a wreck waiting 2 weeks.
Yeah.
I would be a wreck. Oh my
Right.
goodness.
So we saw those numbers, coming out of the pandemic, and we said we need to fix this, and we really have.
I just know if I have, some odd pain or whatever, which is always, but just getting into a primary care doctor is forever. So if there was something that I could do to expedite,
Exactly.
why not?
Exactly. Yeah.
Are there any particular age groups or demographics that Planned Parenthood focuses on for STI prevention?
So yes and no. So in terms of focus, we do try to match or mirror the CDC's guidance. So one of those areas of focus is patients who are between the ages of 16 and 24, because that is the age range where we see the highest rate of infections. And again, I would say in our local data, we would say more maybe 16 to 35 is where we see the highest rates. But then the other big push that we have been making is to make sure that patients of all ages are having at least one HIV test, that we have on file, that they know the result. And so we've really made a push, the first time we meet someone, it doesn't matter what they come in for, that we are talking to them about getting, just routine screening, regardless of their risk, for HIV and for hepatitis C, which is recommended by the CDC. And we've had quite a number of new HIV infections at the first visit, the first time we met the patient, sometimes, coming for something totally unrelated to STIs, and they just hadn't been tested in years and they didn't know. So, while we do have a little bit of a focus on age, we want to make sure that everyone is getting at least periodic screening.
Awesome.
So looking forward, are there some new advances in STI detection or anything that you are excited about how it's going to transform sexual health?
For sure. So when it comes to PrEP, which we talked about, there's a new form of injectable PrEP that is looking really promising in the studies, that is actually an injection twice a year. So that could be a real game changer. If you could come in twice a year and be protected against HIV for that, 6 months at a time, I think that could really revolutionize HIV prevention. I think DoxyPep, like I mentioned, just seeing the uptake of that and really trying to build the awareness so more people have access to that tool to protect themselves. And then I think there are, all kinds of potential new technologies that we've learned, especially because of the pandemic. There are a lot of downsides, but there were a few good things that came out of the pandemic. Telehealth is one, but point of care testing is the other. So, there are a few companies working on that, and there are, some options on the market. None of them are perfect. So, we are exploring what that might look like for us to be able to offer point of care gonorrhea and chlamydia testing, meaning just like a COVID test, you collect your swab, you put it in the thing, and then in a few minutes before you leave the health center, you have your results. So I think that that's a direction that I'm, hopeful that the technology will get where we want to see it for us to be able to adopt that technology. Because how great if you could know your results before you left, get the treatment right at that same visit. I think that could really help close the gap.
I agree. So my favorite part, one of my favorite questions of the whole interview is, if people were to take away one thing from this podcast, what would you want that one thing to be?
I know. Test.
Right. Yeah. I really think that is the right answer, because there's so much that we can do. Like we said, on the one hand, all of these STIs are totally preventable, but more importantly, the long-term effects are totally preventable, right? It is okay if you get an infection. If you know about it early, you can be treated and you can prevent those long-term, harms, those long-term effects on your reproductive health. And you can also prevent the transmission and the spread and the outbreaks that we're seeing in our community. So testing really is the key to, knowledge is power. So we want to make sure that people get their testing done so that they can get their treatment. And then they can move on with their lives.
Awesome.
Excellent. So people listening that want to make an appointment or
Yes.
learn more about their sexual health, or I'm imagining make a donation.
Yeah.
Donations are super important right now. Where should they go look for more information?
So they can go to our website, which is ppsne.org for Planned Parenthood of Southern New England. And they can, right at the top, it says make an appointment, and you put in your zip code and you find the place nearest to you. It's super easy to book an appointment online. Or they can call us at 1-800-230-PLAN, which is 1-800-230-7526. And they can make an appointment there. And certainly if they want to make a donation, which we always greatly appreciate, they can do that on our website as well. And we have a lot of educational materials too, if people want to read more about, testing, prevention, birth control, gender affirming care, anything else on the website, they can feel free.
Dr. Best, thank you so much for your time. Thank you for all of this information. This has been great. Thank you so much.
Thank you.
Thank you so much for having me. This is great.
Have a great day.
You too.